Hello, I'm Dr. John White, Chief Medical Expert for Discovery Channel. A diagnosis of a neurodegenerative disease such as Krabbe disease or Hurler syndrome takes a once healthy child down the road of physical decline, often resulting in blindness, paralysis, and possibly death. It not only changes the life of the patient, but the lives of the families as well. There's no proven treatment or cure for this family of diseases, but doctors at Children's Hospital of Pittsburgh of UPMC are leading the way to identifying new treatment options. At Children's, pediatric neurologists and cord blood and bone marrow transplant specialists work closely to quickly evaluate and treat children with these life-threatening diseases.
Neurodegenerative diseases are diseases of the brain in which children are usually born normal, and then because of a usually genetic problem, they start regressing. Our first patients had Krabbe disease, and that grew incredibly in terms of the population of kids that we see. We, in our clinic, are seeing following about 80 patients, which is probably the largest number in the world in a practice. But we see other diseases like metachromatic leukodystrophy, adrenoleukodystrophy, Hurler syndrome, Hunter syndrome, Sanfilippo. Because these diseases affect only the brain, they end up living a long time until the brain degenerates enough that it causes them to stop breathing. So they're pretty awful diseases, especially for the parents. One of the things that we're offering here now is we have the program for neural development in rare disorders. And we are now able to provide to some of these children treatment by using unrelated umbilical cord blood transplantation. Instead of bone marrow, we use cord blood because you can get access to cord blood much faster than what you would for bone marrow.
As a cord blood and bone marrow transplanter, I'm very excited to work with Maria Escolar and the NDRD team. I think here at the Children's Hospital, close proximity and back and forth communication in terms of the patients arriving, being evaluated for the stage and progression of disease lets us quickly give an assessment whether transplantation is a potential treatment option for that case. And we're very excited that we are able to offer transplantation as little as in 10 days after a family might arrive.
We also have a clinical research program that is funded by NIH, and we also get industry sponsored when they are developing treatments because they have to understand what is the natural course of this disease, and we have such a large number of patients with these rare diseases that we're able to provide this information to them.
So transplantation is a process that takes several months. Neurodevelopment takes many times years and years and years. So the NDRD team and Maria are going to follow these children for years to see if the outcome is truly benefiting them in the cognitive, in the gross motor, fine motor, and social skill level, which obviously has a many year, if not decades, span to fully evaluate.
I'm not aware of any other program doing what we do in the world, and I think that's the reason why families are traveling from all over. We've done this now for 12 years, and I continue to follow some of those patients, many of which should have died at age 2. They are improving, they're learning new things, they're not degenerating. We've been very successful with some of the diseases. It's a very difficult thing for the families to do. They need so much help in taking care of these kids. You are empowering these parents to take care of their child and helping them through the process, and that's huge. That's huge help. So they should never be sent home with the message that there's nothing to do, there's a lot we can do. And I think that would be the most important message I would send.
The Program for the Study of Neurodevelopment in Rare Disorders at Children's Hospital of Pittsburgh of UPMC brings a multidisciplinary approach to treating these diseases and provides care, support, and advocacy for children and families facing this devastating diagnosis.